What is bronchoectasis and which are the causes?
The main mechanism of the etiopathogenesis of bronchiectasis is related to the so-called vicious cycle. That means that the damage of a lung results in an inflammation, that results in a chronic infection, that results in increasing the damage of the lung. And so the inflammation is the main point of the bronchiectasis etiopathogenesis, and chronic infection is the main actor in the damage of the lung. So the problem is to stop this kind of vicious cycle, and this may be obtained by a better rehabilitation, respiratory rehabilitation, better treatment of inflammation, and better treatment with antibiotics of our patient. We know that in the literature, most of the diagnosis, etiological diagnosis, is based on a very limited bundle of diagnostic tests, leading to the fact that almost 30% of the cases are classified as idiopathic. That means nothing. So we need to improve our diagnostic tools to reach the higher number of etiological diagnoses, because this means a better treatment for our patient, because we can identify treatable traits for our patient and leading to a better management of the patient.
Which is the role of phenotypes in bronchiectasis?
Phenotyping on bronchiectasis is still an open problem. Certainly we have to improve our diagnostics testing, trying to identify the different clinical phenotypes. One of the main phenotypes has been identified in more than 3-4 studies is the phenotypes related to chronic Pseudomonas infection and frequent exacerbator. In the patient where chronic Pseudomonas infection and the exacerbation are 2 or more per year, you have a worse prognosis of a patient with an increasing mortality that clearly identify one of the most important phenotypes in bronchiectasis. Still, we need more research, because phenotypes is really a big problem in bronchiectasis.
The cystic fibrosis was associated to a very high mortality in children. Now has become a long life disease. Which are the new problems?
Cystic fibrosis is one of the most frequent inherited disease. Is an autosomal recessive disease that in Italy, for example, affect about 6,500 people, and the life expectancy 20 years ago was about 12 years, and now we have the life expectancy that now is nearby to 50 years. So we really change the life expectancies of our patient, and this was obtained by a multidisciplinary team working on cystic fibrosis in dedicated centers. And the other point is that they improve in the management related to the use of inhaled antibiotics, to pulmonary rehabilitation, the use of a correct diet. Diet is very important, because cystic fibrosis affect also gastrointestinal tract, and certainly the new drugs that are modulator or potentiator of the CFTR protein, that is the main protein affected by in the disease, that control the ion exchange in the epithelium, and clearly is related to the improvement that we expect in the next year in the life expectancy of our patients. Which are the future directions
for cystic fibrosis?
We expect to have a further improvement using new drugs that works on CFTR protein. And the other point is the gene therapy. So working on the gene and trying to modify the mutation, or with the gene editing, or changing the gene that is present in the cells through the action of vectors like virus that can bring in the epithelial cells genes that works. Still a lot of work to do, but certainly in the next future we will have new weapons in our armamentarium for treating our patients.